to all of you, and a very warm welcome to all the doctors, students, practitioners, and homeopathic enthusiasts for joining us today. On the behalf of Homeopathy 360, I'm Dr. Mansi, and I would like to thank you for all for taking out your time to be part of this important and insightful webinar we are going to have tonight. It's my pleasure to introduce our today's speaker, respected Dr. Rahul Jadhav. Sir, a very, very warm welcome to you. Now it's time to introduce Dr. Rahul Jadhav is a leading classical homeopath with over a decade of clinical practice across Satara, Karad, and Pune. Renowned for his inspiring and clinical rich teaching, he is a sought after speaker who has conducted numerous seminars across Maharashtra and an international clinical workshop for European homeopaths. He actively promotes evidence work-based classical homeopathy through regular academic sessions and his popular Case of the Week series on social media. He completed his BHMS in 2008 from J.J. Madgam Homeopathic Medical College and later completed his MD in Homeopathic Repertory from the same institute in 2011. Sir has been frequently invited to conduct homeopathic seminars on multiple forums across Maharashtra, and his previous seminar that received excellent response include Amravati, Belgaum, Dapoli, Satara, and etc. Recently, he conducted an international 3D clinical homeopathy workshop for European homeopaths, strengthening the global reach of classical homeopathy. Now, it's time to talk about the case and about the topic we are going to have today. A very interesting topic, it seems from the title itself, which is a case that questioned diagnosis, a baffling bleeding disorder. So it's a very interesting title. I guess many of us are very curious for what is inside in this session. So would you like to spare some time and would you like to say a few words? Why did you choose this topic?
Thank you so much, Dr. Mansi, a marketing head and editor of Homeopathy 360. First of all, thank you so much for giving such a wonderful platform and organizing this event at such a late time, sparing time for this and enthusiastic intro also. Here, I would like to answer the question that why the title. So Dr. Mansi and everyone who is here, I'm very happy that Dr. Mansi, more than 68 is the count. That's really encouraging. And it's only possible because of wide network of Homeopathy 360.
Thank you, sir.
So basically why we are choosing this heading, Dr. Mansi, we are conducting this kind of case to remedy session since last more than 2 years. If I'm not wrong, this is 63rd case that we are presenting completely non-commercially, and almost every month I try to give the case beforehand, because many times what happens in webinars that we keep on talking monotonously, a kind of therapeutics. It should be some interactive session. So we give the case students, practitioners beforehand. They work on it. I also work on it. And together we discuss this case in this live session. So for them, it becomes them a workshop-like experience. We also learn from it and the attendees also. So it is a bilateral joy basically that we are trying to give.
Definitely, sir.
So as the count is reaching 70 plus, let's start with the presentation, Dr. Mansi.
Sure, sir, sure.
So should I share my screen?
Yes, definitely, sir.
Okay. Actually, I was waiting for that. So I hope everybody has gone through the case. Okay.
Definitely. And in such case, we will also upload the case online so that students can go through the case after the webinar. So
Yes, yes.
also.
Dr. Mansi, if I'm clicking on the share button, it's not getting shared. Should you make me some host or something
Yes,
set?
sir. On tapping this share button, you can see
Yeah.
the option of share screen.
Yes, yes. Now it is visible. It was
Yes.
not earlier. Yeah. I think my screen is visible to you
Yes, sir. Yes.
and my face is not coming in between the presentation. Just check it. Okay.
No, no, sir.
Okay. So here is a very interesting
Sir,
case. Yeah.
your video is visible at the two place. So I guess you can
Switch off my
off.
video. Okay. So while sharing, what I will do, I will share only screen, not my face. Okay.
Or if sir, if you can if you want there, then you can
Yeah.
switch off a video from here, from the
Yes.
Zoom platform.
Yeah. Yeah. I'll switch off. That will be better.
Yes.
So yeah. But I've switch off my
Yes, yes. Switch off.
yeah. Now we will try. No, in that case, my face is not visible. Only my background, the DP is visible.
Yes, yes, sir. Now try sharing your screen, sir.
Now screen and PPT is in my background, right?
Sir. Now the screen sharing is okay. Now you can see the options on the Zoom where is mic and stop video. So you can click on
Yes.
stop video. Okay, okay. But I guess this way is not working. You
Yeah.
have to on
So
your.
what will happen? No, what will happen if we keep because
Yes, sir. This way is fine.
hmm,
That's okay.
because that's an option for attendees. Either they can look into the small screen or
Or
everyone,
right.
please be super active in the chat box. That is the only investment that you have today. Okay.
Okay,
Please be
sir.
in
I
the
also
chat box.
want to ask from the audience: is the voice too low,
Yeah.
as one is saying?
Hello, can you hear me clearly?
Can everyone hear properly? Yes, we got the yes, sir.
Host and so I think my message are only to the host and panelist. You can
Yes,
see
sir.
the chat box, right?
We can begin.
I think you can see the chat box only, right?
Yes, sir. I can
Okay.
see your
Okay.
video as well as case.
But it's not possible for me to see the chat box, right? Chat.
No, so you can see when the questions from audience arrive, they will come into Q&A option.
No, if I on the simple chat box that is in the above bar.
Chat box, I guess chat box, sir, is okay. Let me change. It is for everyone now. Send to everyone. But Q&A is better for the audience.
Okay. So without wasting a single minute, let's start with, please, Dr. Mansi, you take care of chat box.
Yes.
As you can see, the demonstration of the case by looking at the picture itself, it must be very clear to you that this is going to be an amazing learning experience for you, me, and everyone who is in the love with the science of homeopathy. Okay, so this is a case of suspected bleeding disorder. Just a 12-year-old boy from my city, that is Satara, has on October of this webinar that I have a very long follow-up, as long as 12 years of follow-up. Just a minute. There is a message about the internet is not fluctuating. Dr. Mansi, am I clearly audible and visible? Confirm it once again.
Yes, sir.
Okay. So the main concern of this boy, see, I remember clearly the first day when this boy's family physician approached me. So actually the thing happened like this. First of all, this boy living in a small village has started with this strange kind of complaint. So what is the complaint? As you have seen in the first slide itself, he was bleeding, and this bleeding was not of a trivial kind. It's very strange kind of bleeding from the different parts of the body. He kept on bleeding on and off, on and off, and this went for not 1 month, not 2 months, but entire year. So as usual happens in every case, they consulted the modern medicine, and when it wouldn't give any relief, their family physician approached to me. Why they approached to me? Simply because I have been seeing their father, some of the family members, and that's why they approached me. So now I will step by step tell you what happened to this patient and how this unfortunate boy landed into this kind of complaint. Before that, let me tell you, when this patient came to me, understanding the seriousness and depth of the case, I have first given them a specific time, that instead of morning rush clinic, I called them specifically in the afternoon when there is a little bit lower rush. Now, interesting part is that it was my initial year of practice. Okay, I had been trained under the respected Dr. Amarsin Nikam sir from Pune, who runs Aditya Hospital, and before that, Dr. B.S. Bhosle sir from Miraj, Maharashtra. Both are wonderful classical homeopath, and there I got a training that if you want to crack the case classically, instead of going to the snapshot prescription, please have a sufficient time for the case. It has been said by Dr. Samuel Hahnemann also that if you got a 12 hours to cut the tree, spend 11 hours by sharpening your axe. Okay. So in the similar way, I decided to go through the case very thoroughly. So as you can see, what happened to this boy, that before 1 year, the main complaint started is from ear. Okay. So there was a some watery, sticky, more of a bloody kind of discharge from the ear. Now, obviously for this condition, they went to the ENT surgeon. Now this ENT surgeon suspected some local lesion, but in spite of treatment, in spite of looking properly into the ear, he could not find anything outside. So by some strange calculation, he concluded that there is some local lesion, and let's go for the tonsillectomy. You must be knowing there is a dictum in the modern medicine that when in doubt, cut it out. This is unfortunately very true. So they have decided to go for the tonsillectomy, as the boy was having continuous, this kind of discharges. They also agreed for the same. As soon as this tonsillectomy is done, the very unfortunate thing started happening. Instead of just ear, he started bleeding from multiple sides. Okay. Now they went to the MD physician, then pediatrician, then hematologist, and all kind of one after another specialist and super specialist in the city. Now where he was bleeding, it was hands, nails, ear, a long list of location that you can see in this slide: eyes, forehead, sometimes knee, forearm. So it is very strange to even imagine that a boy can have this kind of presentation. Okay. Now, what was the frequency of this presentation bleeding? It was not just once a while in a week or not. It was every day. Soon we will see patient's mother's video, patient's video, where they narrate this whole story, But for as of now, just remember that he was having bleeding, and it was since 1 year, not a single day. Yes, you are reading it right on the screen, that not a single day has been passed without bleeding. So this is a first referral letter. So as you can read it clearly, referring here with Akash Kadam, his name of a boy, a case of bleeding tendency. For further investigation and treatment, kindly do the needful. So ENT has done this, all this stuff like removing tonsils, and now he's bleeding. Now he has referred this case to the physician. Okay. Now case comes forth like physician. Physician has again written that referring here with the same boy, he has a bleeding disorder. So the another doctor could not find something. Please see him. Then there is a pediatrician who has sent him to another super specialist, hematologist, that Akash Kadam is having bleeding tendency since last 1 year. His investigation do not suggest any specific disorder, question mark vascular disorder. Kindly investigate and advise. So you can see from case went from ENT to MD physician to pediatrician, and now it is into hematologist. Right now in front of you are the original, unedited, authentic lab reports of the same patient. So you can see bleeding time, clotting time. Basically, this is done by a well-known veteran hematologist. Okay. Now hematologist has gone through the first line of investigations, which is usually they do, like bleeding time, clotting time, and there are again prothrombin time, partial prothrombin time, even this ureal stability of the clot, thromboplastin generation test. So all kind of test was done in his own lab. Okay, for the confirmation. And then he came with this interesting letter. My dear friends, please pay attention, read this letter very carefully. I'll read it for you. You can also see. Thanking you for asking me to see Mr. Akash Kadam has a suspected bleeding disorder. The suspicion, just a minute, I will just zoom it so it will be better visible, right? Yes. Yes. So you can see, thank you for asking me to see Master. The suspicion for suspected bleeding disorder, the suspicion was aroused by unprovoked bleeding from multiple slides. Enclosed here are with the results of various investigation. These are within normal limits. I do not think that he has any bleeding disorder. This brings her back to see the interesting part. Back to initial question. Back to initial question. Why is he bleeding? Then he has written, I suspect that the bleeding is due to some local lesion examined by ENT surgeon. After bleeding, there is no region noticed. Tangled are peculiar in that become invisible after bleeding. So there is a bleeding and there is no any kind of hematoma or swelling. So this is a peculiar. So this is written by the MD physician. Okay, sorry, hematologist. Now I will go again to the yes. Okay. So basically, we have come to the point that after this all journey of ENT, MD physician, pediatrician, hematologist, they have back to the question why he is bleeding. Now let's move forward. So why is basically bleeding, and what was the modern medicine answering? Modern medicine's answer was just something like this, isn't it? Okay, so basically, Dr. Samuel Hahnemann has said that physicians are my brother. We have utmost lecture for all the respect and gratitude for all these physicians and hematologists and ENT, and we are not here to mock them, but to clearly, assertively emphasize them that there lies some upper edge or the advantage that our homeopathy science has over this brethren. So these are our brothers. As the participant counts is reaching more than 100, I'm very happy that this is 10 p.m. and so many are still there with us. So we will go to the next part. and I'll ask question to this 100 attendee that what is the difference between homeopathy and modern medicine? What is the difference between homeopathy and modern medicine when it comes to the understanding, interrogating, and curing the disease? I want you to be little bit active in the chat box, because see, try to understand, like I have said often, and this is not a boastful thing, that this is not a yet another lecture that you are hearing, but what I'm presenting you is after a follow-up of not 1 year, 2 year, but 12 long years. Yes, my dear friend. Soon you will be seeing the video of this patient before treatment, after treatment, and after 10 years of treatment. I have waited so long simply to establish the authenticity and superiority of the science. Superior is the wrong word actually, but definitely upper age that we have with the other schools of medicine. So here I want you to be active in the chat box, active in the question and answer section, and tell me what is exactly difference when we interrogate the case. Please, because here I cannot see your faces, but yes, soon you will see the indications.
So, any answers from the audience?
Okay, we want what is the difference, like how we see the case, how that ENT has seen the case, physician has seen the case, hematologist has seen this, what additional that we are going to probe. See,
So, we have few answers like Kriti
yes,
Sinha is saying homeopathy works on symptomatology and totality, whereas modern medicine works on diagnosis.
very good, Kriti. Yes, symptomatology is
Kashvi,
the word. Kashvi, yes, Kashvi is from our team.
yes,
What Kashvi
Kashvi
is
is
saying?
saying because our pathy considered psychology, pathology, and physiology.
Exactly. So basically, Dr. Mansi, that is what we teach in the our session, okay, our
Hmm.
clinic, and Dr. Kashvi has rightly pointed out. Please see this slide very, very carefully. This is the way in which you can communicate, convince to your modern medicine friend. Actually, convincing will not do any help. We are not
Yes,
here to convince anyone. We don't want, affirmations from others, but still the entire focus of the modern medicine was on the pathology, what is inside that, what is in the organ, what is inside the tissue there is cell, what is inside the cell there is nucleus, what is inside the nucleus there is DNA. Now all these they are keep on probing, at the same time unfortunately missing the important part, that is physiology and psychology of the patient. Now, these terms are given by none other than legendary Dr. Amartya Nikam sir, who is my mentor, teacher, and who is well known worldwide for running exclusively homeopathic hospital for more than 25 years now, and is still running. Today, I'm presenting this session from city Pune. I come here for visit, and this is in same city Pune, Pimpri Chinchwad lies this hospital. So when we talk with Dr. Nikam sir, so he in the very easy language used to coin use these three words. So this ENT physician, MD physician, hematologist are all seeking for this pathology. We have two more areas to probe. What is the psychology and what is the physiology? Now we ask often this question to the student, what is the physiology? If anyone can answer in the quickly in chat box, please. What is the physiological point that we probe in the case? Pathology is, of course, the one with bleeding, right? Psychology is one that we are going to see. But what is the physiology that also we ask in the case taking? Anyone? Please be attentive in the chat box because I can't see the chat box.
so we have question and answer box, and
Yeah.
answers are normal functioning of body. Pragati Singh is saying.
Yeah, yeah. Okay.
And
Yes, yes. I can see Dr. Akib Khan has also, yes, Parshuram Patil sir has written very well.
Prashn,
Okay.
yes, and Parshuram Patil say while everyone looks disease in a man, but we homeopaths look into man in disease. So
Even Dr. Prasad
Prasad,
Kulkarni.
yes,
Yes.
Prasad Kulkarni is saying factors deficiency.
Yeah. And Dr. And Mr. Philip Joseph has also written very nice that looks a whole man disease. So feature, yes, we do ask. Dr. Megha Patil's answer. Please, everyone keep an eye on the Q&A because very
Yes,
nice
sir.
answers are coming, and that are
Yes, sir. Irfan Khan is saying skin issues.
No, skin issue is basically with the pathology is concerned. Okay. What I'm asking is what physiological point. Physiological point are exactly written by Dr. Megha Patil, a very sincere homeopath from Pune, my classmate. Okay. So please, so this asked for example, imagine you go to some orthopedic surgeon with your mother for her knee complaint. Ever they ask for what do you like in the food, like sweet, sour? Never. Ever they ask that whether you feel cold or hot unless you are a thyroid patient? No. So these are questions though pertaining to the physiology. We do ask simply to understand the man in disease better. So we interrogate the what I ask in the initially. We interrogate the patient from three different aspects. Okay, where modern medicine only unfortunately focus on the one aspect. If ever they consider some mind aspect and all, they will send you to some kind of psychologist or psychiatrist, which is an entirely different story. Everybody knows it. Okay, so in this case also, I called that patient, please come afterwards. Calmly and patiently and sincerely, I kept on interrogating each and every detail, like what happens before bleeding, what happens during bleeding, what happens after bleeding. So what he said, before bleeding, there is pain at the site of bleeding, headache always precedes the bleeding, throbbing, right-sided, extending backward, there is heat of the part. That is number one. Now during episode, what happens that there is a lot of weakness, pains, feeling exhausted. What happens after bleeding? That bleeding stops after a few minutes. There is no mark. It was underlined by hematologists also that telangiectasia are the peculiar that there is no mark. Okay, he feel weak, exhausted, as if not eaten since 2 to 3 days. So it is a very debilitating kind of bleeding. Now here I got one very interesting and important point. What he said when I asked him, when you get this kind of bleeding, what is the trigger of bleeding? So he was very a less talkative person. We will see in the mind section also, like after this. Okay, so he said that ragavल्यावर, it's a Marathi, when after anger. So I was like shocked for a few seconds. We have heard that after anger we get redness of eyes. We have heard that after fear we get goosebumps. We have heard that after tremendous fright something get involuntary urination, but this was simply saying that I get bleed, a frank bleed after anger. So this is something that I thought that what I am considering is much more than the respected masters in their own pathies. So I keep on probing further. So right now in front of you is the entire journey of disease. At the age of 1 year, he was having corazon sneezing. At the year of 8 years, he was having occasional epistaxis. At the age of 10 years, he was having bleeding from this ear, then tonsillectomy, then went for tonsillectomy and bleeding from multiple sides. So it is a complete journey that we consider. You can call this as a past history, journey, life space, everything. Again, we probe family history also. Father has cracks and palms and soles. Grandfather, sister, both are healthy, no major issues. Again, these are the physiology point that I was just talking about. See, meticulously one by one, we are kept in probing these things. Just a minute. So appetites reduced, but can tolerate warm desire for warm food, potato chips, chicken, fish, pungent spice, pickle. Cold drink was quite prominently told by him. I can remember. Food aversion, he doesn't like some eggs and sweets. Eyes with a lot of burning in the eyes. Sometimes better by cold water. There is an history of epistaxis as well. So that was another, past history that I got, epistaxis. And you can see this bleeding things were extending, sometimes bloody vomiting, extremities. Sleep was, he was late sleeper, sleep on the abdomen, restless, irregular time of stool, perspiration, scanty aggravation by sun heat. Now here comes a important part. We have covered the pathology, this is the pathological part, bleeding part. Then we have covered the physiology. This is a physiological part. Let me know, Dr. Dhanashree, are you here? Now, I will request her to read
Yes,
the
sir.
mind part. Okay.
Okay. So the live space.
Let me know. No, actually, I'm requesting from PDF Dr. Dhanashree. I told her. So can we take her on her voice, like unmute? This is the
Yes, sir.
PDF,
Sure.
right?
Right, sir. We can take her.
Yeah. So is she there? Let me check it. Anyone else has PDF? See, what we want is, you know, we want to read this mind from the PDF, because I have not prepared the different slide for that. Just a minute.
Participants cannot have this option of unmute.
Dr. Mansi, is it possible that you can unmute? Hello?
Yes, sir. Whom do I have to unmute?
Dr. Dhanashree. Dr. Dhanashree. You have to search for that. Because this
Yes,
mind.
sir. I have changed this
Yeah, I can see.
setting. Hello,
Yeah, yeah.
she can. Yes, sir. Hello.
Yes, continue.
Mind and life space. The patient was a school-going boy, studying in the seventh standard and belonged to joint family. His father was a farmer. As per parent, he is headstrong and obstinate. If he wanted something, he instead of getting it and became irritable when opposed.
Please, everyone,
Doesn't
listen carefully. Yes, please continue.
doesn't listen to parents and behaves in a stubborn, inflexible manner.
Yeah.
He dislikes sharing things and has lots of complaints about his younger sister and cousins.
Yes.
Cousins. They tease him, to which he did not tolerate and reacts aggressively. His anger was violent in nature, often expressed by throwing objects, abusing, biting, or physically hitting others. He was dominating by temperament and has been pampered at home. At the same time, he was lazy and preferred watching television for long hours. He liked good clothes and new bags and toys. His school performance was good. He was intelligent and quick to grasp, and there were no major complaints
Yeah.
from teachers. If any quarrel occurred at school, he would come home and complain to elders or teachers rather than handling the situation himself with occasional outbursts. Emotionally, he expressed dislikes and resentment towards family members and would sometimes say that they were not his own. He was not very communicative and often avoided direct interaction, hiding behind elders. Religious inclination was not prominent. On direct questioning regarding the trigger for bleeding, the patient stated clearly episode usually occur after getting angry. Whenever he became intensely angry, especially after getting ridiculed, which he can't tolerate, a bleeding episode often followed. During such moments, he often lost control, threw objects, and occasionally assaulted those around him. During the consultation, the child answered in a quiet and reserved manner. His responses were brief and slow, and he spoke very little unless specifically asked. Thank you.
Okay, so meanwhile, thank you, Dr. Dhanashree. Meanwhile, I have managed to open this PDF that we have already sent you. And I think many of you has already gone through this PDF. So one by one, we kept on interrogating that we actually learn in our college. You know, there is nothing what we call as some different dramatical or some glamorous way of approaching the case. It is a simple way, that is, we ask about the life phase. What happened to your family? How you are behaving? Who is in your family? That day in and day out we do. Okay. So what is in front of you is a boy. The boy who is living in a joint family, very headstrong, obstinate, instead of getting very irritable when opposed, doesn't like parents, behave in very stubborn, inflexible way, dislike sharing things. Teasing is something that I can clearly remember, that he said, I cannot tolerate, doesn't share the things with others. School performance was good, intelligent, very quick to grasp. There is no major complaint in the teachers. But if any quarrel happens, then he would come home and complain elders and teachers rather than handling situation. With occasional outburst was definitely there. Emotionally, he is very express dislike and resentment towards the family members. Would sometimes say that they are not my own. Okay, so they are not having he's not having very good relation with the others. He was not very communicative, avoided direct interaction. Now instead of, okay, so let's go back to the case. And happy to see everyone active in the chat box. Let me. Yes, Dr. Kashvi and all answering accurately. Now we'll go to the presentation PPT again. Everybody is with me? Are you understanding the depth and seriousness, the intensity, and the interesting parts of the case? Yes, very good. Okay. When opposed, when ridiculed, yes. So I'm sharing my screen again just to start the PPT. Okay. So we have come a long part. We have seen patient's body language and all, no? So ENT, pediatrician, MD physician, everything is now over. Why is bleeding? Unfortunately, what happening? We have covered all pathophysiology and mind. We have read in depth about the mind of this patient. And again, I'm coming to the next interesting slide. Please get it imprinted in your mind. You know, Dr. Kent has written beautifully that what is the sick? The sick is the important chapter that we study as a student in our college life. This is a place, this is a time to implement this and day in and day out in our practice. So whenever we speak about the sickness, it is not only the pathology, it is not only a single molecule, cell, tissue, or the organism in its entirety. And we have seen many of us has rightly answered about this, because totality is the important part, isn't it? And in this way, we have tried to, you know, give nomenclature to this. So pathology, physiology, and psychology, and we consider these three. So again, I have divided this case into these three platforms. See, there are n number of practicing ways of practicing homeopathy, as happens in every science and every art basically. So you see the cricket, there are some faster bowler, there are some spinner bowlers, some of the, you know, picky bowlers and different kind of bowlers. Similarly, everybody has own style of practicing, but still, if we want to align ourselves with the scientificity and rationality, we should use the nomenclature in that way. Now, right now in front of you, what we have done is divided the symptoms into three distinct parts. The pathologic part, that is unprovoked bleeding from multiple sides. We have shown you the bleeding time, clotting time, reports, investigations, referral letters. In the physiology, we can see desire, aversion, sleep, thirst, etc. And psychology about the mind aspect. Okay, so let's move forward. Now we are about to analyze this case. Up to now, just we have gathered the information, gone little bit technically, mechanically, clerically, you know, just keep on noticing. Now you tell me, what is the most peculiar? What is the most peculiar, uncommon thing about this bleeding? Everybody in the Q&A, please be active. 90 plus attendees. Wow, wonderful. I hope everyone who is in this webinar, please take my words. There is something very special to learn that you will remember forever. That's the effort that I have specifically put in presenting this case before you, and with the bless of Dr. Samuel Hahnemann. So Dr. Prasad Kulkarni, as bleeding after, yes, bleeding after anger, no doubt that this is the most important thing, definitely. Bleeding for multiple side, Dr. Arshay, yes. Lisa, anger, yes, anger and multiple places, both are important. Yes, Dr. Kashvi, opposed anger directly goes bleeding without leaving any marks behind. Yes, so there is no mark behind. So see, now everybody is near the crux of the case. Okay, there is some emotional trigger that is disturbing this. For example, see, consider this is a patient. Okay, now it is her milieu interior. Now it was under some stress, and due to some stress, some pathology, it was found an outlet in the ear, right? Now what we have done, what the respected ENT has done, has stopped this discharges some way by interfering, by intimidating this personality by procedure, by surgical procedure, by tonsillectomy, and now it has gone haphazard. It has gone into the turbulence. The system has gone into turbulence and started behaving like irrationally and throwing the sickness in the multiple ways. Okay, and it is triggered by anger. So as Dr. Bina Hingorani is saying that yes, there is an element of suppression. You're right. Suppression is true. Anger is true. So how you will put the word something which is having, these are the two important things. We have to move forward because basically we could have discussed for more time, but we have to, go to the next slide. Now, this is from my opinion. When I was sitting in that chair, after all the mess in front of me, and the unfortunate boy was bleeding in front of me, and that family physician was requesting do something. So what I can understand that there is not explained by organic pathology. So it is not a specific bleeding disorder that is missing. This is something inexplainable, that is for sure, and that is not from me, but by the opinion of respected hematologist and all. Again, there is another interesting, that is something precipitated by emotional factor. Now, if this kind of case come to you, forget bleeding. If any other kind of illness come to you without an explained organic pathogen which is triggered by emotional factor, what is the specific word that you can use? Please be active in the Q&A. If you can crack this word, you can solve this case at your clinic also. I want one precise word which is not explained by organic pathogen, has emotional factor. For example, yes, if I give example, you will understand, but still, Prasad Kulkarni, yes, please, I want word that we can give to this kind of combination. No explainable organic pathology and triggered by emotional factor. When I sit in Pune clinic, I'm usually accompanied by a very enthusiastic homeopath, Dr. Sarang Jadhav sir, and he's very nicely coined this word, like Parshuram Patil sir and Dr. Elizabeth Turso. Psychosomatic is definitely word, but we can't put psychosomatic in the repertory. Can we put psychosomatic in the repertory? Like we use, if you open synthetic and put psychosomatic, will any rubric come out? For example, patient is coughing, there is bad cough. You take X-ray and the X-ray is normal. Normal X-ray, but patient is coughing. Normal X-ray, but patient is coughing, and it is triggered by, like, someone has scolded me and I got fever. It is written in one of the remedy that patient has got bad, scorned by the teachers and come home and get fever. So Dr. Kalyani Vaikar and many other, Dr. Kalyani Vaikar, Dr. Arshia, and of course Dr. Sarang Jadhav rightly said, this is nothing but hysteria, my dear friend. This is what we say as a hysteria. Okay? Hysteria It's something I'll show you. See, each and every slides and dots and comma in this slideshow has been, check and recheck. So I'm not going to leave any question unanswered. If I got chance to present this case in 100,000 people, then also I have all the documentation. So why hysterical? I'll tell you. Before that, I will tell you that this hysterical kind of pathology is not just cough or not just psychology, but it is a hysterical bleeding. I have never felt that in our literature we can find some counterpart of this. मुझे कभी ऐसा नहीं लगा था कि इस हिस्टेरिकल ब्लीडिंग के लिए होम्योपैथिक लिटरेचर में कुछ मिलेगा. But this beautiful legacy of Dr. Samuel Hahnemann and work of hundreds and thousands of provers has given us the armarium, जिसको क्या बोलते हैं हम, इतने सारे वेपन्स हमारे हाथ में दिए हैं कि वो हमें भी सरप्राइज करते हैं. सो आई हैव फाउंड इट नॉट इन सिंथेसिस, नॉट इन केंट, not in Fatak, but in boric repertory, hysterical hemorrhage. Yes, delusion is mostly Neelam, Dr. Neelam is in the mind level. It is a purely hysteria, and I was surprised. Initial days of practice, some limited number of patients, and the joy that we get. Patient is bleeding in front of us with the emotional trigger, and here we are getting rubric, not in the synthesis, not in the synthetic, not incomplete. Now maybe it in the complete, I don't know, but clearly in the boric. Okay, so this is the explanation that is there. Can you see this slide clearly, Dr. Mansi?
Yes, sir.
So can you do me a favor and read the meaning of this rubric as written on the slide? Just a reading. If you can see it clearly. Hello?
Yes, sir.
Yes. So I was saying that to read this one, but I think it is clear, visible. Okay. So meaning of rubric clarified. That's what I was talking about. It is an hysterical hemorrhage, a bleeding that is not explained by organic pathology, that is out of proportion. So some are saying that not able to see the screen. Dr. Priya Anand, Dr. Venkata, can you see this? Dr. Mansi, can you please coordinate? Can you see the screen?
Yes, sir.
So, okay. Yes. So, okay, you can see the screen. So it is very clear that not explained by organic pathology, out of proportion, clearly precipitated by emotional factors. So basically, this is an hysterical thing. These are some of the beautiful reply came from all of you as the answer of this case. All of you means, let me tell you here that we run this kind of case. This is more than 60 cases we have shared, and we run WhatsApp group. Okay. In this WhatsApp group, we post this case. Now you can see the case, and these are the beautiful reply given by different doctors that are part of this group. And you see, this is a poll. Okay, these are some of the remedies. So this is a very open discussion that we usually do clearly. And these are the replies that we got. Everybody works on this case. See how beautifully they have made this is Vishal Sawan. This is our team member, basically associate me some couple of years. So my dear friends, this is the efforts. This is the basically effort that are needed to create a miraculous result. Nothing else. Going back to the PPT. Refresh your screen. Okay. I think you disabled my screen. Okay. Dr. Mansi, just take care of some replies. Okay.
Yes, sir. Sure.
Can you see the number of remedies, everyone, clearly, Dr. Mansi? all the remedies: phosphorus, sulfur, ferrum, china, ignatia, lycopodium, carbovage.
Yes, yes. A group of medicines.
Yes. Okay. Group of medicine. Now see, one by one we will eliminate one by one. So phosphorus, definitely phosphorus is something which we have been reading, that bleeding tendency. Then again, there is a patient started with right side, which is a phosphorus thing, burning, desire for cold drinks. Yes, these are all matching with phosphorus. But what is missing in phosphorus is phosphorus actually is open, affectionate, sympathetic that we hear, and fearful. Here, this boy is basically aggressive, violent. How he was answering? Anger, no, nothing else. So very, very brief, what we call as an abrupt kind of answer. Laconic is the word. Laconic, एकदम sharp answers. He was not phosphorus, open, affectionate, sympathetic. Neither he was fearful. So that is the reason why we rejected phosphorus. Okay. The next is, of course, sulfur. Sulfur has a burning sensation. This patient has also localized burning, heat aggravation. There is superficial hemorrhage is also covered by sulfur. Then there is scanty perspiration, heat intolerance. Patient has some gastric problem. This patient is also have some gastric problem. What missing in sulfur is this child's aggression, violence, domination. Sulfur is actually egoistic, philosophical, a kind of careless, theorizing boy. But sulfur easily share things with others. That we must have read in our books, that sulfur is very, social. If you ask something sulfur, he will give it open hand, like a king. Many times we read in so-called mind rubric that delusion, he has wealth, lot of things. That's why he's easy to give for easy for him to give the things, which is not the case here. Now, again, hemorrhagic character is not that much marked in sulfur. Okay. Now, again, what is the remedy? Anybody want to have any comment? So, Anonymous is coming with pulsatilla. This is pulsatilla for, our basic idea with pulsatilla is also always with mild, people pleasing, attention seeking. These boys are look on the contrary, very happy, not happy, very much settled in his own world. Not having have to do with anyone else. Yes. Now we will go to the belladonna. Belladonna is very good option, but you see, belladonna during the episode of pathology or acute becomes a devil. Otherwise, they are like a angel. We are social, cheerful, talkative, laughing, light mood. This is a belladonna. Here he is not like that. Okay. Sulfur, I already answered. Ignatia is coming close. Ignatia is matching here in the sense of hysteria. Hysteria is very important for Ignatia. But do you feel that Ignatia will become so much aggressive in the simple teasing, making, jesting? Okay. So yes. So these are some of the things that are, let's see what is the remedy. Many are still answering. Please, your answers are very, very important to us. Please keep on. But what I can remember is on the October 2012, I have given 30 single dose of the remedy, which I am going to tell you, of course. Bleeding reduced in the after first dose itself, after a few days. It has become 3 times so. It has not stopped altogether. Please understand it well. Exhaustion was reduced. Then bleeding from ear 2 times was again observed, which was initial symptom, if you can recall. Then there is throat pain. His voice is hoarse. His voice is very, rough voice. That is also you can notice. Then there is no bleeding in the November month. Then he was better. Then some pains in some loose motions we consider as a good sign. I can clearly remember I have given nothing except ORS for that time. There is no episode of bleeding in the 2013. In just few months, he was completely out of this bleeding. Okay. Now he is going well in the clinic, in the school also. So my dear friends, you can see this is the beauty, this is beauty of the classical homeopathy. We'll go to the remedy, but before that, this boy has got literally new life. Okay, after this remedy. Just a minute. Actually, right now I am in the hospital where I do my consultation in Pune, and I have to take just 10-second break. There is someone knocking. Very sorry for interruption. So now I know everybody is very curious about the remedy part. So without wasting a single minute, I am moving to the remedy part, but I hope you have enjoyed the process, which is equally important. Yes. Okay, so up till now we have seen the case, the details, all the referral letters, patient's mind, how homeopathy has an upper age. Then we have analyzed the case. We have understand why it is historical, deeper meaning of hysteria. From the boric, we have found the homeopathic counterpart, the meaning of hysteria, all the remedies, exclusions, and the wonderful follow-up. So this brings us to the final part, that what is the remedy? Hemamelis, Dr. Neelam, is very much mild remedy. There is a rubric in Hemamelis that very want respect and give respect to other, number one. And it is a passive hemorrhage. And there is a mentally patient is very much, what the word is, very much giving respect to others. Okay. So this is a difference. Now we have seen the follow-up video. Okay. Yes. So this is a repetization. And as Dr. Sarang has said, as Dr. Arvind has said, as many of you has rightly told Dr. Arshia, Dr. Neelam, and Dr. Sunaina, Anonymous, Dr. Prasad Kulkarni, and many of you, it is nothing else than Merck Sol. Okay. So I'll keep the chat box. It is a Merck Sol. Okay. So you can see elements on anger is important. Now you will see very interesting part after this. Okay. In few minutes. But before that, try to understand the refinedness from humor is very. See, this is a retrospective repetition. It is not like that I have put these symptoms and Merck came up. No. But there are some important part like ailments from injuries and operation that is covered by Merck. Hysterical hemorrhage, which I have been talking continuously about. Okay. In this rubric. Yes. This is also mercury. A frank, outburst, impulse morbid to do the violence. And you will surprised to hear that bloody discharge is also 3 mark mercury. Okay. So this is about the mercury. Now, interesting thing happened after that. I have completely forgotten this case. 2 years, 5 years, 10 years, 12 years has passed. And in just last few months, right now I'm in Pune. In this my Pune clinic, that boy, one fine day, this boy has came. Then I was just recalling about this case, and then he said, I thought that he's some different fellow. But he said that, do you remember when I was very small, I used to come to you for this bleeding, and today I have came again. So I thought that whether he has again this bleeding. So he said, no, I just came to meet you and tell about her one of other case. So you will surprise and happy to hear almost all pediatrician, all ENT, and even hematologist. Now I can see him after 12 years. There is no recurrence at all. We have given only a single remedy, few minimum doses, and this is a long-term follow. तुला आठवते त्या ब्लिडिंग एपिसोड बद्दल सांग, तेव्हा यायचं तेव्हा रक्त कसं यायचं? I am again
किती
asking
यायचं?
in bleeding episodes.
गरम वाटायचं आणि दुखायचं खूप.
So he's again saying that there is a warm bleeding and all.
कानातून वगैरे तर असं
Ear, can you see? He's showing clearly his right ear.
खाली व्हायचं. कापूस वगैरे ठेवला तरी ते पूर्ण भिजायचं. चांगली गोष्ट. आता ते काय नाहीये.
No, nothing. So I think this is much more than enough for you to understand the beautiful, action of classical homeopathy and the pathophysiology and mind. So we are in the end part of this session where we will see about this. So remedy was Merksol, and after 12 years he was also doing fantastic. Some of you has talked about lachesis. So let me tell you, lachesis and the entire Ophidia group is concerned. They are very loquacious. Here is a laconic. Laconic is very small answer. I have shown video in other seminar. Like you see some kind of don, a mafia don. You can see Amitabh Bachchan in Sarkar. You can see Godfather movie. So the don just answer like 1-2 words, sentence, a strong gaze. So that is a laconic expression. It is not a loquacious expression. It is a laconic. And of course, Merksol go for the physical violence, and lachesis is more of a verbal attack is more. Answer to answer, quick answer. They just never let their word down. Like this is a main difference between laconic. Okay. So I think this is more than enough. 1 hour is already past, 1.5 hour. This is Dr. Rahul Jadhav, and me with my better half, Dr. Dhanashree, is conducting these kind of sessions. And this is our WhatsApp group. So before we end this session, let me give you, these are our numbers. Okay, you can really, for any homeopathic query, online consultation, and especially sessions, this kind of session, contact, save this number. You can communicate. I hope this case has strengthened your belief in the classical homeopathy as led by Dr. Samuel Hahnemann. Evidence-based, long-term follow-up, something which we can, with a confidence, show in front of entire world that yes, this is a science of classical homeopathy. Thank you everybody for participation. These are some of the things from our WhatsApp group. This is more than 600 of where we conduct this kind of cases analysis. We are not bombarding you with a lot of information because already we are so much engaged in the practice. But yes, 1 case a month is what we have given commitment, and that we are following as both since last 2 years. You can see this is the notes that Dr. Dhanashree takes. These are handwritten notes most of the time that we provide of the remedy. And these are our contact. So thank you everyone. And I will request to take some question, answer, responses. Dr. Mansi.
Yes, so any questions from the session?
We are already getting some nice responses.
So
and
many of us, many of our attendees are saying, thank you for sharing, congratulations, beautiful case, sir, and wonderful case. Thank you so much. So everyone is thanking you.
We wish that this interaction goes long, and we keep on learning and growing ourselves. Any question? Yes. So why 30 potency? Yes, repertoire analysis is already shown, Dr. Sunita Patil. 30 potency is a big question. I have told you that I am a student of Dr. Amar C. N. Nikam sir, the legendary Amar C. N. Nikam sir, who run 100-bedded homeopathic hospital in last more than 25 years. So we have seen wonderful result with 30 potency. It is not like that we can't use 200, 1M, 10M, but it is equally true that in most of the cases, 30 potency work wonder. Okay. So this is why we are using 30 potency. Proving us in 30 potency. Yeah. And even some of the literature has also written that just after few months ago, I have presented case of Kali carb. And in that also, of course, I have given my 99% practices with 30 potency. So I have given 30 potency. So one of the attendees shown me from Kent lecture that Kent has written that Kali carb is a very dangerous medicine for gout. But if you give in the 30 potency, it will do good. So there are n number of literature. I will not say that you just listen to me and use it, but you try in your own clinic. It is written by Dr. Samuel. It is told to Dr. Samuel Hahnemann by his father that accept nothing, reject nothing, please employ, try everything. It is said by Gautama Buddha also that don't follow it because it is written in some spiritual sculpture. Don't listen because it is told by some guru, but assess yourself. So do follow. This is my experience. Yes. Please stay connected for, you can ask question on this numbers also if you want. Yes, any more? Dr. Mansi, you would like to summarize and conclude?
So I would like to thank Mr. Dr. Rahul Jadhav sir for this wonderful session, and we really inspired by your research, by your clinical insight that you have put it in this case, and the way you analyze the case. It was beyond the thinking, and this was really impressive. And no doubt we learned so much from you today. And we really happy that this case will be very soon on the
Your
YouTube. On the YouTube, this session will be very soon available on the channel Homeopathy 360.
Yes,
So
thank you once
thank you
again,
so
Dr.
much.
Mansi, for this wonderful platform, being there till 11. It's really wonderful platform, Homeopathy 360. We have always advised our students for this wonderful quiz also, and they get so much motivated. Every month they are waiting for this activity. So not from the commercial point of view, but you are looking for the betterment of this science, and that why really
Definitely.
I myself approach you for this. Okay. Thank you, everyone.